Most men listening to this episode today don't have prostate cancer. And that's exactly why this episode matters. My guest today is Michael Bovarnick. He founded the Prostate Education Project, not as a doctor, but as a patient in the middle of his own treatment because he went looking for answers that he needed and he couldn't find them. He's been through the diagnosis, the surgery, the recurrence, and the hormone therapy. He's now in his 80s and he's answered all of it by building something for other men. Michael, welcome to the show today. So most men listening to this podcast probably may not have prostate cancer, probably don't even really realize what the prostate is or what its function is in the male body. But for those that don't know, so I'll just start by saying the prostate is unique to men. It's a small gland in the male reproductive system that produces semen and helps with the flow of semen and ejaculation. So unique to men, and that therefore prostate cancer is unique to men, right? And it's the most prolific cancer in men. I think I read that a stat that you had posted before, 330,000 or so men are diagnosed annually with prostate cancer. Is that accurate?
Yes, Jonathan. Those numbers, by the way, come from the American Cancer Society in 2025. As an example, they estimated known diagnoses of females diagnosed with breast cancer are approximately 350,000. The estimated number of known diagnoses of men with prostate cancer is 330,000. So the similarity is there. The numbers of annual deaths specifically to each disease are almost identical. Although generally with prostate cancer, most men will die from something else versus directly prostate cancer. But as we are all well aware of, and certainly women do a wonderful job in promoting breast cancer and the awareness of that, and we don't see or hear very much about prostate cancer and the awareness of that and the severity of the degrees of prostate cancer. And of course, there are various degrees of that.
So maybe, and we'll get into all that, but one thing I wanted to start with was just asking you about your experience with prostate cancer, what eventually led you to create what we're going to talk about today is the Prostate Education Project.
And it started for me 23 years ago when I was diagnosed, and again, I'll preface it again, my father died from prostate cancer. So I had some experience with seeing what had actually happened. Again, that's many, many years ago, and protocols have changed. But I was diagnosed at age 59 with a very aggressive prostate cancer. And because of my father's situation, I chose to have it removed surgically. And I was living in Boston at the time and was able to find a surgeon that had expertise. And interestingly, at the time, the only surgeon in the country that was able to do a laparoscopic radical prostatectomy. This was well before robotic surgery was in vogue, so to say. And when he went in and did the surgery, the cancer had 1 centimeter to go before it broke out of the course. There were no nerves taken, which certainly affects sexuality. No lymph nodes were involved. And I was very fortunate that I went 20 years of being cancer-free. And about 2 years ago, my PSA, the PSA evaluations change when you don't have a prostate versus still having one. So the numbers, the base number with you want to be undetectable, and my number started to go to 0.2, and that was the benchmark of when you start saying, well, you could have a problem. Ultimately, it rose to 1.7, and at that point, I realized it was a serious problem. Went in for a PET scan, and at that time, it showed 2 nodes on my left pelvic wall. Which necessitated, and again, because of my mentioned before earlier that I have a son-in-law in the business out here in Reno, and he was able to arrange quick appointments for me with urologists and radiation oncologists. Ultimately, needing with the radiation oncologist 5 days of pinpoint radiation for those 2 nodes because it had, per the PET scan, had not spread. And the first, by the time I went in for the PET scan, my PSA had gone to 2.7, which again was a considerably advanced cancer. Um, and the first PSA post radiation, PSA dropped down to 1, where they were thrilled. But at the 90-day mark, when they do the second one, I was back to 3. And that created some other problems. I went in for another PET scan. The PET scan showed the original 2 nodes were destroyed. However, a new node popped up on top of the old 2, and it had metastasized to a spot on my T9 transverse process. And being a trainer, it's in the back. And that created a concern. So that necessitated the going on of what they refer to as ADT, androgen deprivation therapy, which essentially kills testosterone in the body. Prostate cancer feeds off of testosterone. And was on that for 2 months, and then went back in for more radiation, again, pinpoint radiation on the 1 node, and then on my back. And yesterday, I went for my PSA test, 90-day markers. I've been on an ADT holiday for 90 days just to give us a break. And my PSA is still, thank goodness, undetectable. So we're just waiting to see the testosterone numbers now. And hopefully I'm in some form of remission again. But you never get rid of this stuff.
Right. Well, that's good to hear. At least you got some good news yesterday. I do have one question on that. So the first time you were diagnosed, you had your prostate removed, and then you were re-diagnosed. If you have your prostate removed, this may be a silly question, but if you have your prostate removed, where does the cancer show up then if you are re-diagnosed?
And again, I emphasize in all of this stuff that I'm not practicing medicine here. And this is, again, from a lived experience and my own education, dealing with and discussions with my medical team. The prostate cancer, even though 20 years ago, there still could have been cells within the body that were dormant. And statistically, and again, this is from numbers from Johns Hopkins University in medical schools, the chances of somebody, even the 15 to 20 year mark out, has a 1.5 to 2% chance of prostate cancer returning. So, I've been an advocate of continuously having PSA tests just to make sure and following this. Many doctors, unfortunately, stop testing. Like, if you're cancer-free for 15 years, they'll stop testing. And I had one doctor tell me that same thing. If I had been his patient, he would have stopped at the 15-year mark, and my answer was, yeah, and I would have been dead too. So, so the bottom line is, to answer your question directly, there can be cells that have been dormant, and I don't want to introduce another potential subject, but it was coincidence. My increase of prostate PSA numbers was coincidental to the last COVID vaccine shot. So we can't prove it one way or the other, but there's some suggestions, and I say that cautiously, that may have lit up the fire in the body, so to say, and awakened those dormant cells. We'll never know. Unfortunately, it is what it is. Yeah. But it's now a matter of, okay, how do you deal with it? And then when it came back, I realized, and again, talking to my son-in-law and talking to people at the hospitals here, the lack of education is just incredible. And there's so many things that happen to the body, and that's what motivated me to start the Prostate Education Project.
So when your first diagnosis and you had your prostate removed, what happens to your body when you have your prostate removed? What are the things that you go through initially?
Initially, the fear of, okay, what's my life expectancy, number one, and did we get it all? How long is it, how long can I be in remission? And for myself, again, as I said earlier, the fact that the prostate was totally contained, the cancer was contained within the prostate, you have a left nerve and a right nerve that controlled your sexual function. Those were spared. So going back to that, once I got over the the surgical process and dealing with a catheter, I was very fortunate that I had very few side effects, meaning uh, no dripping, urinary dripping, which is a common problem. Um, Occasionally that happened, but not severe. And life went on. Basically, I have a very uh, wonderful wife, caring wife, and concerning. And we were able to still maintain a very active sex life, quite frankly, and life was good. And there we are 20 years later. So for me personally, uh, never thinking that this was going to return, but you're always living with that fear that you have that potential. I don't know if that answers the question specifically.
Yeah, I was curious specifically what happens in a man's body without a prostate.
Really, to answer that, without the prostate, if the nerves were spared, the only thing that basically, if you're from a sexual standpoint, you're ejaculating. You're not, you shoot. Pardon the expression. You're shooting blanks. That's it. There's no active sperm anymore. But other than that, nothing changed.
Is removal the first line of defense as far as when a diagnosis happens? What is the percentage of removal versus treatment?
It's a tough one. I don't know if there's any exact numbers. And again, that was for me. It was a choice, and I'm going back 23 years ago, and protocols certainly have changed today. And depending on the degree of cancer and the stage of cancer that one is, and again, mine was diagnosed as a fairly aggressive cancer between my PSA number and what is referred to as the Gleason score and the biopsy. Um, and the choices then were essentially removal because I fit a protocol. I was young enough and had a physical body to be able to do it. And the particular technique. The choices then went back to radiation, and the radiation 23 years ago is totally different than it is today, and or androgen deprivation therapy. Those basically are the choices.
And then with your re-diagnosis, you went into pinpoint radiation in androgen deprivation therapy. So can you kind of explain those treatments? Because it sounds, from what I've listened to what you talked about before, it sounds like the ADT, and you can explain this, but maybe more challenging to men than just having the prostate removed by itself, like some of the side effects and stuff.
Jonathan, these are the things that people, you go in and you don't know the questions to ask when you need to know them. And because clinicians are great, but they don't have time to tell you all of the things and experiences. And quite frankly, in my opinion, unless you've gone through this, you don't know what to expect. So going back to your question, for me again, speaking personally, the I was because of where the cancer is or was, they were able to do pinpoint radiation more often than not when somebody still has a prostate and it metastasizes out of the prostate. It generally hits the lymph nodes within the prostate area, which then necessitates more of a full abdominal radiation program. Many situations it require doing that depending on the severity of the cancer. Could be anywhere from 5 to 8 weeks of radiation every single day, 5 days a week.
Wow.
And that in itself, again, creates other issues, both urinary and bowel. And typically, ADT therapy is associated with that. Basically, the ADT therapy puts the cancer to sleep. And then I'll go back to either radiation, with the radiation oncologists, go in to kill what they can see through the radiation. But again, generally it's ADT first and then radiation along with it, depending again on the severity. And that's what my situation was, even though I was able to still do the what is referred to as SBRT, pinpoint radiation. But the androgen deprivation therapy, that's another whole discussion separate. I mean, the side effects that itself causes. And and the choices that you have in ADT therapy, which is another area, because you have oral medications and you have injectables, and each has its own sets of issues.
Let's talk about ADT because that's interesting to me just from a training perspective because of a lot of the side effects. But I think I read somewhere that it basically brings your testosterone down to kind of castration levels.
ADT essentially is medical male castration, for the lack of a better term. My testosterone went to less than 3. Okay. And it has maintained itself at less than 3. And even though I'm on this quote ADT holiday, the side effects of ADT, and again, depending on whether you're doing injectable or oral, sleep deprivation, terrible. Intake of fluids um, generally goes to the lower extremities. So at night, you're laying flat, it all comes back up. It's not uncommon to be urinating 3, 4, 5 times a night. So that affects sleep quality. Androgen deprivation therapy, again, can affect heart, it can affect insulin levels, diet, it affects muscle loss, bone loss. So starting out with this thing, I chose to make sure I had a bone density exam, see, having a starting point. Exercise becomes critical to help maintain some muscle. And it is not uncommon to put on, because of the insulin and metabolic changes in the body, it is not uncommon to gain weight in the abdomen. It's not, and again, and I say gain weight, stuff you read and see and hear is not uncommon. 5 to 10 pounds is not unusual. So controlling the weight factor, again, I come back, exercise, diet is critical. And you know, alcohol stops if you were drinking any alcohol. The body just can't tolerate it. And the processing of, because liver function is critical and kidney function is critical. It's not fun. And interestingly enough, adding to that, and just to digress, again, because of after I was on the ADT for 7 months, and during having PSAs continuously during that 7-month period, and each time I had a PSA, the numbers were fortunately the same. The medical oncologist allowed me to do, as I mentioned earlier, a 90-day ADT holiday. Well, one would think that when you stop the medication, that, oh boy, the body is going to it's going to turn around. But now the body is saying, pardon me, what the hell are you doing to me? Because you've been controlling me for 7 months, or however long you have been on this stuff. And now you stop this control factor. Now the body is saying, okay, now I have to rebuild this testosterone. Well, the testosterone at my age, again, especially, it doesn't happen overnight. And I'm still finding that, interestingly enough, the side effects for the first 4 weeks, 5 weeks were worse being off the medication than they were on the medication, because the body's trying to readjust. And I just, again, had lab yesterday, type bristle. The lab numbers are crazy because of the testosterone trying to readjust in the body, and the testicles starting to work again and creating testosterone. And let me go back and digress a minute, because with the ADT, it's important to understand that you have injectables. One is a 3-month injectable, one is a 30-day injectable, and now you have an oral medication called Orgovyx. The difference being is once you have this injectable, any of the injectables, it's in there. If you have any side effects, real bad side effects, you're stuck with that. It's in your system. Whereas with the oral medication, which is what I chose to do, the life of a pill of the oral medication is 25 hours in the body. Now, certainly it takes time to flush out, but you have greater options, if you will, if you don't tolerate it.
One thing that struck me is that it's fighting against everything that we're already struggling with as we get older, with the muscle loss and the weight gain,
Absolutely.
even sleep. So those kind of three there, the sleep, the muscle loss, the weight gain. How are you specifically dealing with those? Because I know you have a bunch of literature on your the website, the Prostate Education Project, about dealing with those. But what were some kind of specifics that helped you deal with those?
Uh, First thing I did is I got some help mentally because you've got to be able to rise above this. And I had some great counseling from my medical team. Um, and I understood the need to, if I want to try to deal with this as best as I can, I've got to follow the protocols. And again, exercise became a religion, and whether it be heart, I get up every morning and I do a series of upper body exercises. And again, diet is very, very important. And I drink aloe pure aloe every single day. I've been drinking that for 23 years, and I think that helps the digestive system. It helps the stomach to stay clean, which being in physical training, you understand, uh, the, everything works through the stomach.
Yep.
So um, this way, they said for me personally, just the diet, the exercise, and just more than anything else, realize that there's still light at the end of the tunnel, and this is not, I I can't let it control me. I have to control it. And education, by the way, education is key. That's one of the main factors of this whole thing. Is learning as much as you can about it, and everybody's situation is different.
And how did you deal with this with your wife? Because well, especially like just the sleep deprivation alone can be just a mental challenge. I mean, knowing that just from my own experiences, every time I don't sleep good, my mood isn't the best the next day. I don't feel great the next day, but I can't imagine the kind of loss of sleep that you experience with this, plus on top of everything else. So how do you deal with that kind of those mood changes and especially like in the context of being in a relationship?
Uh, Again, ADT therapies typically you understand more about what a woman goes through with hormonal changes, because part of that, it the hormonal changes, I understand completely about night sweats, and that's that's all part of it. So I have a full appreciation of our female partners going through menopause. But yeah, because that's again, I don't talk much about it, but yeah, you wake up at night, you're sweating, and so it's dealing with it, and having an understanding partner is a is just wonderful. And unfortunately, too often when men are diagnosed with this, their ego gets involved, and they think that sex is everything, where it's really, they forget how to be intimate with their partner. And I have a very understanding wife. We've been married for 62 years, and um, it's that helps me. But I'm not afraid to be open and talk about it. Where unfortunately, too many men are embarrassed about this, and are just don't know how to deal with it. And from the emotional side, ADT typically, again going back, affects the hormonal factor, and one can become very, very emotional. I mean, I've heard crazy stories about men will start crying on the drop of a hat because of the how it has affected their testosterone. For me, honestly, it's been a blood. I think I've become more emotional. I have become a better person and more emotional to my wife and more
That's
understanding to my
good.
wife.
So it all sounds like, I mean, can't imagine the challenges you go through on this, but maybe shift gears then and how is there any way to, or I guess let's start with the screening because, you know, we get every 3 to 5 years get screening for colorectal cancer, right? Women
Right.
get breast cancer screening every 1 to 2 years. I can't remember what the number is on that, but Why is there not a screening available to men or pushed on men from the medical practitioners on prostate cancer?
I can't tell you the whys, but I can give you a little, perhaps, history. Back in the 90s, there was a big push against PSA testing because of the potential for false positives. Okay, and even today, the that same feeling and theory you know, is still out there, and that men don't need to have PSA tests until their 50s. Well, knowing what I know now and the amounts of cancers that are being diagnosed in men in their 40s and early 50s, and some with severe metastatic cancer and dying, um, my argument is I'm a firm believer in doing more testing on a regular basis, and uh, I'd rather have a false positive and go through that than end up with a metastatic cancer in my bones and throughout my body. And so I'm an absolute advocate of prostate testing, even if insurances don't cover it. They're cheap tests. Generally, a PSA test in most labs is 100 or less, and to me, it's worth the price of admission just to make sure that the prostate is functioning well, and you have a benchmark of where you are, because with the prostate, the number is 0 to 4. That's the magic number, and the physicians look at continuously the continuous checking PSAs. If a PSA doubles within 6 months or a year, that's a real indicator that there could be a problem. But I've never stopped doing PSAs. I'm fanatical about it, and it probably saved my life. And it's hard because they're just, even though they're prostate cancer organizations, we don't see the promotion of testing like we do with breast cancer testing, as an example. And I'll go back years ago, if you're a golfer, um, when Arnold Palmer was alive and well. Arnold Palmer had prostate cancer, and he started what was known then as Arnie's Army. And there was a really big push way back when he was active for prostate education and prostate testing. And you just don't hear it today. You just don't. And there are more tests being developed other than the PSA. So um, for years there was just a lack of testing, and unfortunately there is no uniformity in the medical community as to a standard, so to say.
Sounds
I
like
hope that answered the
at this
question.
point, yeah. So it sounds like at this point, you basically, the man listening to this, you have to be your own advocate and ask, especially if you're in your middle ages or older, ask to have your PSA checked, because I think that's done through blood work, right? So it's
That's blood
fairly,
work. But I think and again, not to belabor it, I think one of the real problems is most men just don't really understand the necessity or even realize until something happens. They have a urinary problem, they have an enlarged prostate problem, um, of what the potential is with prostate cancer and the necessity for testing. And unfortunately, today, too many primary care doctors don't do the test. Again, medical protocols, wherever it's coming down from the government saying you don't need these tests, you shouldn't do the test until later on in life, whatever the reason is. And I'm just an absolute proponent of, education, and that's key. And some of the key phrases that I use that I've written down here: knowledge reduces fear, understanding builds confidence, and education empowers patients. And I always end with, cancer changed my diagnosis, and education changed my journey. And my hope is that this whole thing can help change others in their idea of what's going on. So I certainly don't have all the answers, but my goal is to try to help as many people as I can.
Yeah, and I think just the starting point of awareness, you and I were talking before we started recording, is just like the awareness just isn't there for other,
It is not. Right.
cancers and screenings, even though it's the most prevalent among men. Are there any other specific signs and symptoms that men should look for? And in that same vein, are there any things that you've read about? And I know neither one of us are doctors and you're not a doctor, but for like risk reduction in cancer and prostate cancer.
Interesting question, because the answer that is from, again, what I've read and stories that I've heard and discussing with people, very often, if cancer has metastasized, um, you don't necessarily see it through the prostate or through urine, no discomforts. But very often, if it has gone into the bones, one of the most common areas is pains in the shoulder, interestingly enough, because cancer,
Okay.
if again, depending on the severity and if it has metastasized in the body, the common area is the back and the spine, and that reflects your profession in therapies and training. It'll start with pains in the back or other muscular problems, an indicator. And again, especially depending on age, we might say, oh, we think it's a golf swing or whatever it is, but it is not uncommon to have body ache pain. And again, then it's already metastasized. But unfortunately, this is one of these diseases, if you will, the cancers, really, until it's almost like pancreatic cancer, and until it's too late, you don't know it's there unless you're getting tested.
So that's the first line of defense is just
Test,
getting
test, test.
tested, right? Anything that you've in all the research you've done over the past 25 years or so about risk reduction, anything like men could do just day to day with diet? Obviously, like exercise is a big thing. Like I think I read that even there were some studies on the around the ADT where just strength training
Right.
really is one of the number one things for the muscle loss.
And not talking clinically, and again, just I guess more from a historical in seeing in reading, if there is prostate cancer in the family. In case my father had, and I have an older brother who has had cancer, not prostate cancer. But the question is, if there is cancer, and specifically prostate cancer in the family, there is a very high potential that the male offspring will end up with it, or a good friend of mine I've known for 30 years, who I was just with on a holiday, um, age 69 years old, active guy, bicyclist, really active cardio wise, but he now has metastatic prostate cancer. And his father had cancer, and interesting now, that my friend's brother also has prostate cancer. So I think going back to the question is, yeah, if there's some family history, you have the, the greater potential of it hitting you of some type.
So one, the PSA check. Two, the understanding your family history, and those are the two biggest
Yes,
buckets as far as risk reduction, right? And then we're getting close on time, but I did want to spend some time talking about the Prostate Education Project that you started. So can you tell folks a little bit about that, why you started it, and how people can interact with it?
as I said earlier, when I was re-diagnosed 3 years ago now, I just and trying to find answers to questions that I was not getting from my clinicians. What was happening to my body, why it was happening to my body, and that motivated me, and it made me realize that there's such a lack of education that just some aura came over me and said, let's try to do something. And I worked with my son-in-law, the physician, and who introduced me to some people at one of our major hospitals here in Reno. And I started writing, and I developed a book, and they loved what I was doing, and the book evolved into the website, and the it just grew and grew and grew, and the more I experienced things, I was able to write about those experiences. And the Prostate Education Project now is, we refer to it really more as a library, an informational library. And as I said to you earlier, we now have converted that program to also 100% medically accepted universal Spanish. So, which is, we talked about, is certainly an underserved community, especially in our areas where we live. So it motivated me to do something and to continue to do something. And my goal, quite frankly, at my age now, um, I'm hoping that the Prostate Education Project becomes a living legacy beyond my time.
My understanding is there's now doctors and clinicians involved on it too.
Oh yeah, we have one of the largest urological groups here in Reno. They use that now, and amongst others, quite frankly, they're using it now for their patients. And again, not that the clinicians don't have time, but again, I'm talking about everything from a lived experience, and being able to provide their patients with information that helps them on coming back in with questions that they're experiencing, things they didn't know they needed to know. And so, yes, very active. Actually, this particular group is doing a 5K in 3 weeks, which we'll be participating in. I've been asked to be a guest speaker in opening up the race, so that kind
Cool.
of gives me a
Okay.
little bit more motivation. But one of the things I think it's important to talk about is understanding too that we touched on it, but to understand really how this disease and prostate especially affects not only the male but the partner, the spouse, and that can change families, not just can change families. And because again, most men are just afraid to talk about it, don't know how to talk about it. And I'll give you one example that I always use. Uh, I jokingly say most men have two brains, one in their head and one between their legs. And unfortunately, too many men, jokingly, I'd say, add a little comedy to this thing. And most men think with the one between their legs and think that their whole life depends around that. And that's not what controls your life, and especially the intimacy with your partner, and knowing how to deal with too many times you read how this has affected relationships, and we have women who are writing comments about how they are having problems now dealing with their spouse because they won't talk about it. So anyway, it creates a whole different family dynamic, as any
Yeah.
cancer
So,
does. But
but that's interesting because it sounds like the the Prostate Education Project is not just a resource for men, but also for women
oh
too,
no, absolutely, yep,
understanding like what their partners are going through.
absolutely.
Um,
We talk about it in the website. Absolutely.
and I found it just, even you don't have to have prostate cancer to go to this library. I found it super helpful in just understanding more about being aware of prostate cancer and the treatments and stuff like that. And that kind of informed me to, okay, well, I need to start getting my PSA checked with my doctor.
And I tell men, Jonathan, if your doctor says you don't need it, I say get a new doctor.
Yeah. Well, and I mean, I'm 47, so I'm right at that, probably
Oh, you
the
are
age.
absolutely.
Yeah.
You absolutely. But and I can kind of, I always kind of tell a joke, not so much of a joke, but my first medical, quick story. My first medical oncologist that I was dealing with here was this absolutely lovely, lovely young woman, uh, just wonderful, beautiful. And here you think about some guy in his 50s, 55, 60, thinks he's a virile, this, big guy, and all of a sudden he's got prostate cancer. And now that's his doctor. And he's got to go in and start talking about if he's on androgen deprivation therapy, he has to go in and ask him, why are my testicles shrinking? And talking about sex and so forth. And I could care less. It doesn't bother me at all, having gone through my surgeries and stuff. But most men have a difficult time dealing with this. And that's, again, part of the problem. They're, again, either afraid to ask, embarrassed to ask, didn't know the questions to ask. So,
hopefully the education that you put out there in the library and a podcast like this will kind of help men, bring awareness and even talk about it. So as we wrap up, is there any parting thoughts you want to leave to a man listening to this in regards to prostate cancer or anything else?
the only thing I would just say, everybody's cancer is different. And certainly there are some that are more severe and others who have gone through androgen deprivation therapy and have become castration resistant is the term that is used, meaning that they're not responding to the therapies anymore and then necessitating other treatments, which can include chemo and now Pluvicto and stuff that's out there now. I would just add that as tough as it is and can be sometimes when you wake up in the morning, there is life at the end of the tunnel, and you can keep going on, and it's something it can be difficult, but life is still important, and you can still live your life.
Well, thank you, Michael, for sharing your story with us and also starting this library. It's prostateeducationproject.org, correct?
TheProstateEducation.org. Yes, sir.
And we'll put all that in the show notes, but it's an excellent resource for anybody, any man who, even if he doesn't have prostate cancer, can go to. So, Michael, thank you for your time today, and we will talk to you soon.
Great. Thank you, Jonathan. Appreciate the time.